Human M-pox infection and morbidity persist since the recent global outbreak. Pause each illustration for detailed study of the illustrations and data contained in this revised review of the literature. Colorized transmission electron micrograph of M-pox virus particles teal, found within an infected cell brown, cultured in the laboratory. Initial presenting M-pox lesions on mother and neonate. A. Mother, left thumb, on day 2 from delivery with a pustular umbilicated lesion. B. Frontal image from presentation in the ED on day 10 of life with an eruption of pustular umbilicated lesions on the forehead, glabella, cheek, and perioral skin. C. Day 11 of life image with lateral eyelid margin involving lesion with no fluorescent dye uptake. All lesions are at the same stage of healing. Umbilicated M-pox vesicles at day 4 of infection. Monkeypox, umbilicated vesicle on the lip, day 4 of M-pox infection. The clinical presentation of the M-pox rash. Monkeypox virus lesions from 2 female travelers returning to Vietnam from Dubai, United Arab Emirates, 2022. A through D patient 1, E through H patient 2. Images show lesions sporadically distributed on different body parts, including on patient 1 between 2 fingers, A, right arm, B, right foot, C, and face, D, and for patient 2 on a finger E, the face F, the arch of the right foot G, and abdomen H. Symmetrical maculopapular rash on the torso, back, and buttocks. Left, symmetrical erythematous maculopapular rash on back and upper arms with areas of confluent erythema. Right, right tonsillar enlargement with an overlying pustular lesion and yellow-green exudate with slight deviation of the uvula. M-pox lesions on male pudendum. Cervical lymphadenopathy in a child with M-pox. Comparative schematic structure of M-pox viral structure and scale. Membranes and membrane-bound proteins are purple. Capsids are in dark blue, and genomes and nucleoid-associated proteins are in turquoise. The monkeypox virus is part of the Orthopox virus genus, which also includes variola virus, vaccinia virus, and cowpox virus. It is the cause of M-pox disease. M-pox is a relatively mild exanthematous disease observed in monkeys and other mammals, including human males and females. It is not believed to be a disease exclusive to bisexual or homosexual adults. Although clinically similar to smallpox, it is not so potentially fatal, being transmissible to human beings. Macule, a flat, distinct, discolored area of skin less than 1 centimeter wide that does not involve any change in the thickness or texture of the skin. Papule, a circumscribed, solid elevation of skin with no visible fluid, varying in size from a pinhead to less than 10 millimeters in diameter at the widest point. Vesicle, a circumscribed, fluid-containing epidermal elevation, generally considered less than 10 millimeters in diameter at the widest point. Pustule, a small elevation of the skin containing cloudy or purulent material, usually consisting of necrotic inflammatory cells. Scab, a dry protective crust formed by a combination of blood, pus, serum, or a combination of various such elements over a lesion during the process of healing. Note the stages and the amount of days involved in these M-pox lesion illustrations. Cytosolic M-pox virus pathways for the viral life cycle. The enveloped virion, EV, enters the host cell by fusion, and the mature virion, MV, by micropinocytosis or fusion. Transmission routes associated with monkeypox infections. Monkeypox is a zoonotic viral disease caused by a double-strand enveloped DNA virus, a member of the Poxviridae family under the umbrella of the Orthopox virus genus, including smallpox. Monkeypox is transmitted mainly by direct animal contact via bodily fluids, blood, aerosol, or infected lesions. Furthermore, it can be through human-to-human close contact or respiratory secretions, similar to smallpox in terms of the clinical features and formation of serologically cross-reactive immunity. Interestingly, WHO reported its primary transmission through male-to-male close physical contact, causing the most recent surge. However, this is not yet a confirmed route of transmission and is under study. Monkeypox has a 7 to 21 day incubation period before the beginning of manifestations, such as fever, headache, cough, and pathognomic lymphadenopathy. That is followed by skin rash on the face and extremities, mainly with the next 1 to 3 days of fever. Monkeypox does not have a definitive vaccine or drug. It is treated as a syndrome by managing symptoms and preventing or improving the complications. The schematic representation of the transmission cycle of the monkeypox virus. In wildlife, the virus rotates in the primary host and can be transferred to humans through various means. From the primary host, the virus can jump into the incidental host, which in turn can infect the human. Additionally, the reservoir of monkeypox is yet to be elucidated. Transmission of human monkeypox. In endemic countries, spillover events occur from zoonotic animal reservoirs into humans, potentially leading to limited outbreaks, usually facilitated by close human contact. Outbreaks can also occur in non-endemic regions through introduction of the virus via human travel or importation of animals harboring the virus. Subsequent human-to-human transmission can then occur via household contacts and via other close contacts. The epidemiological characteristics, pathogenesis, clinical diagnosis, and treatment of M-pox. A. Transmission of M-pox occurs through animal to animal, animal to human, and human routes. B. Clinical symptoms typically manifest after M-pox infection. C. Symptoms of M-pox infection may vary based on the immune status and clinical treatment options, and clinical treatment options are listed. Monkeypox virus infection can have significant impacts on multiple organ systems in the host, including the protective barriers of skin and mucosal surfaces, lymphatics, lungs, and gastrointestinal tract. Skin exfoliation can be significant, and inflammation of the airway and bronchopneumonia can lead to restricted air intake and diminished willingness and/or ability to ingest food and fluids. In rare instances, monkeypox can lead to sepsis. Multi-organ system involvement of M-pox virus. There are two types of monkeypox virus, Clade 1 and Clade 2. Clade 1 causes more severe illness and deaths. Some outbreaks have killed up to 10% of the people who get sick, although more recent outbreaks have had lower death rates. Clade 1 is endemic to Central Africa. Clade 2 is the type that caused the global outbreak that began in 2022. Infections from Clade 2 M-pox are less severe. More than 99.9% of people survive. Clade 2 is endemic to West Africa. Clinical protocols and infection control during monkeypox outbreaks. Recognizing the clinical presentation and having a high index of suspicion are crucial for identifying potential cases. Rapid confirmation through testing and isolation of individuals with suspected or confirmed disease are necessary. These actions should be taken alongside notification of public health authorities for contact tracing and other components of the public health response. Although treatment for monkeypox infection is primarily supportive, antiviral agents and immune therapies could be considered for individuals with moderate to severe symptoms or who are at a high risk for progression to severe disease. Vaccinating close contacts with high-risk exposures and at-risk individuals is also important for interrupting transmission chains and containing monkeypox outbreaks. Appropriate personal protective equipment, PPE, for medical settings consists of gown, gloves, a fit-tested N95 or equivalent, and eye protection. Signs and symptoms of monkeypox. Monkeypox can cause a rash that may look like pimples or blisters on or near the genitals or anus and other areas like the hands, feet, chest, face, or mouth. Other symptoms can include fever, swollen lymph nodes, muscle aches and backache, chills, exhaustion, headache, and respiratory symptoms. Monkeypox 101. Monkeypox virus is related to the smallpox virus. Monkeypox symptoms are similar to smallpox, but milder and rarely fatal. Monkeypox symptoms include fever, headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, and a rash that can look like pimples or blisters. The monkeypox rash can appear anywhere on the body, including mouth, genitals, and anus. The rash will blister, scab, and fall off over a 2 to 4 week period. The person is contagious until the rash has fully healed and a fresh layer of skin has formed. Monkeypox spreads through physical contact with infectious rash, scabs, or body fluids, personal belongings that have made contact with sores, respiratory droplets. Pregnant people can spread the virus to the fetus through the placenta. Have symptoms? Here's what to do. Call a healthcare provider immediately about getting tested. Isolate at home. Avoid any close physical contact. wear a mask when around others. Facts about the currently administered Jynneos non-replicating live vaccinia M-pox and smallpox vaccine that elicits humoral and cellular immune responses to Orthopox viruses. Facts about Jynneos vaccine: 2-dose vaccine given 28 days apart. People are considered to reach maximal immunity 14 days after second dose. Most common side effects: pain, redness, swelling, itching, firmness at injection site, muscle pain, headache, and fatigue. Not known to cause significant side effects. M-pox 2022 Identify, Isolate, Inform M-pox Information Poster concerning disease exposure, management, signs and symptoms, isolation, and reporting to hospitals and governmental health authorities for healthcare practitioners. Exposure: contact with persons with suspected or confirmed monkeypox, or contact with persons with rash consistent with monkeypox, or multiple or anonymous sexual partners, or contact with animals with suspected monkeypox, or travel within 21 days to a region with endemic monkeypox. In the case of exposure only, management: consider quarantine. Vaccinate as soon as possible. Educate exposed person concerning incubation period, signs, symptoms recognition, and transmission prevention. Signs and symptoms: prodrome, fever, chills, lymphadenopathy, backache, myalgia, sore throat, asthenia, malaise, enanthem, cough. Exanthem follows in 1 to 4 days, progression from macular, papular, vesicular, pustular, crust to scarring, all in same stage of development within a body region. Typically manifests initially in genital anal region, followed by face, palms, and soles. Often becomes generalized, not attributable to other diagnoses. In the case of exposure and signs, symptoms under consideration: isolate, don PPE, N95 respirator equivalent or higher level, gloves, gown, and eye shield protection, and shoe covers. Place surgical mask on patient for source control. Cover patient's lesions and rashes. Disinfect patients' and healthcare providers' clothing. Sanitize bed sheets that have come into contact with infectious patients. Place patient in airborne infection isolation. Initiate symptomatic and disease-specific treatments. Finally, inform hospital infection prevention, local and state health departments, and national government health agencies. New presentations coming soon. Like, share, subscribe, and ring the bell for notifications. Thanks for watching. Thank you to current and new subscribers.